Welcome, everybody. While we're waiting for people to jump in, I thought I'd just give you a little bit of background as to what our seminar series is all about. This is our seminar series in lieu of our conference that we had to cancel for the North American Society for Pediatric Exercise Medicine. We were going to host the conference this summer in the beautiful Okanagan, but sadly COVID put a stop to that. So this is the seminar series. This is the last of our 3 seminars, which has been a wonderful time to actually get together virtually when we couldn't actually get together in person. And I'd just like to respectfully acknowledge the beautiful lands that we live in that are the unceded traditional territory of the Syilx Okanagan people. So I'm going to let Sarah do the introductions of our speaker today. But first of all, while we're waiting for our other speakers to join, I've just got a little bit of housekeeping for you all. So first of all, microphones and videos are muted throughout the session, other than for the speaker and the chair. There will be questions, of course, at the end of the presentations, but we really encourage you during the presentations to start typing any questions that you have into the Q&A function. And then our chair, Sarah, will be able to take those questions for you. The session is recorded, so there will be a link posted to all the attendees, and we will have that link up on our website, which will be up and running very shortly. So just a sort of save this screen, we will carry on a seminar series into 2021, and we have some upcoming seminars which we will be advertising in January, March and in May. So please look out for those posts in the various places. Better still, if you join NASPEM, you get onto our mailing list and you will be emailed and reminded about these seminars. So I'm going to hand over now to Sarah Moore. She is an assistant professor at the University of Dalhousie, and she is our current secretary of NASPEM. So thank you very much, Sarah.
Great. Thanks very much, Ali. Thanks for the introduction, and thanks to all of you for joining the NASPEM webinar today. NASPEM is the North American Society for Pediatric Exercise Medicine. It's an organization that promotes physical activity, fitness, exercise science in children and adolescents. It was founded in the 1980s and has a strong history of excellent science and collaborative research. We'll be launching our new website soon, so stay tuned. This year, as Ali mentioned, we have had to cancel the NASPEM 2020 meeting due to COVID-19. And as a result, we've created this webinar series in order to continue to share some of this important work. Today, I'm pleased to introduce Dr. Kelly Arbour-Nicitopoulosto. Kelly, you can go ahead and turn on your screen. Dr. Kelly Arbour-Nicitopoulosto is an associate professor in the Faculty of Kinesiology and Physical Education and an advisory member of the Mental Health and Physical Activity Research Center at the University of Toronto. She also is an adjunct scientist at the Holland Bloorview Kids Rehabilitation Hospital and a co-director of the Knowledge Mobilization for Active Living Alliance for Canadians with a Disability. She's also the the associate editor for Applied Physical Activity Quarterly. She comes with us today with a wealth of knowledge about working with kids with disabilities, and I know that we're all excited to hear from her today. Her presentation will be followed by Q&A, and as Ali mentioned, there is a Q&A function, so if you are not familiar with Zoom, it's just at the bottom of your screen, and you can type any questions throughout the talk into that. The presentation, I'll go ahead and moderate those session questions at the end. So please welcome Dr. Kelly Arbour-Nicitopoulosto.
Thank you, Sarah, for that wonderful introduction. And sorry a bit for playing with my slides. I couldn't find my share video. So as Sarah mentioned today, I'm going to be speaking to the research that I've been leading with several fantastic colleagues across Canada, focused on the movement behaviors of children and youth with disabilities. And I'd also like to acknowledge, in addition to my affiliation with the University of Toronto within the Faculty of Kinesiology and Physical Education, I'm also a co-investigator of a research community partner alliance called the Canadian Disability Participation, which today a lot of the work I'll be presenting to you is under that alliance. So I'd like to begin by 3 messages. If anything you can remember from this talk today, I hope you walk away with. First is that access and inclusion to physical activity plays a critical role on the movement behaviors of children and youth with disabilities. Secondly is that having a reliable evidence base is necessary for effective decision-making on programs and policies impacting the health and well-being of children and youth with disabilities. And third is that multi-center and community partner collaborations are fundamental to building a reliable evidence base on the movement behaviors of children and youth with disabilities. Now, I begin my talk perhaps very similarly to, I think, other researchers in pediatric exercise medicine, where we focus on children. And of course, we bring up the United Nations Conventions on the Rights of the Child in Article 31, where now over 30 years since its first establishment, states that every child has the right to rest and leisure, to engage in play and recreational activities appropriate to the age of the child, and to participate freely in cultural life and the arts. And I think it's really important to bring up this article, given that my focus today on children and youth with disabilities, where we see time and time again, particularly now during the pandemic, where children with disabilities are often denied their right to play, whether it be in their communities, schools, or in their homes. And when I'm using the term disability, I'm aligning that term with relation to the United Nations use of that term, and that being a long-term a recurring physical, mental, sensory, psychiatric, or intellectual impairment. Globally, just over 5% of children ages 0 to 14 experience one or more disability, and less than 1% are living with a severe disability. As we see when individuals age, the prevalence of disability increases, with just under 16% of persons ages 15 years and older living with a disability. And when we compare individuals with disabilities to those without disabilities, we see those individuals, including children and youth with disabilities, tend to have poor physical, psychological, and social health outcomes and restricted participation. And specific to physical activity participation, the quality of children and youth participation is often challenged by many physical and social environmental barriers, including but not limited to high program cost, lack of accessible infrastructure, and negative attitudes of others. Now, I'm sure many of you are aware of the often published reviews around barriers to physical activity for children and youth with disabilities, as well as recent calls to action on how to break down those barriers through quality program delivery and policies that aim to reduce the marginalization of children and youth with disabilities in physical activity and sport. However, having effective policies and programs depend on a reliable evidence base of the physical activity and screen time behaviors of children and youth with disabilities. And this is really at the crutch of the work that I'm going to be presenting to you today in my specific research program. We're building this reliable evidence base on these movement behaviors of children and youth with disabilities, with the ultimate goal of being able to use these data to inform decisions around physical activity programs and policies at the local, provincial, and federal levels. Now, I'm sure many of you are aware of the recent release of the World Health Organization's 2020 guidelines on physical activity and sedentary behavior. And if I'm not mistaken, those were released almost exactly 2 weeks ago. Maybe some of you attended that webinar. And I highlight here the guidelines in relation to physical activity and sedentary behavior for children and youth ages 5 to 17, and those are children and youth without disabilities. We see probably similar to what we see now at different national levels, that children and youth are encouraged to participate in at least 60 minutes a day of moderate to vigorous intensity physical activity across the week on through aerobic activities. On at least 3 days a week, they're encouraged to engage in vigorous intensity aerobic activities, as well as strengthening muscle and bone activities. And within these guidelines, the data, the evidence that was reviewed to develop these guidelines wasn't enough to provide specific durations around screen time, but it is recommended that children and youth limit the amount of time they spend being sedentary, particularly in recreational screen time. Now, what is exciting about these guidelines is that the first time ever they include children, youth, and adults with disabilities as those with chronic health conditions. And I have here on my screen the physical activity and sedentary behavior guidelines for children and adolescents with disability based on the World Health Organization. And you may think, oh my goodness, it must be the previous slide, but no, these are the same guidelines with regards to physical activity and sedentary behavior of children and youth without disabilities. And I want to highlight that within the, or supplementary to those guidelines, is a supporting evidence document that goes through and grades the available evidence. And based on what the World Health Organization's Physical Activity Development Group reviewed, they said that there's moderate certainty evidence with regards to the recommendation for physical activity for children and youth with disabilities, and that there's low certainty evidence around the sedentary behavior guidelines. Now, this really brings back to my earlier point of having a reliable evidence base. Now, if you have not done so yet, I do encourage you to go through that supplementary supporting evidence document. And I had gone through it and to really get a sense of what does the evidence base look like in terms of children and youth with disabilities, at being able to establish these guidelines, particularly the physical activity guidelines. And interestingly, there are a few issues that I have some problems with. And the first being that in terms of them grouping the evidence for children, youth, and adults all together. And then secondly, in terms of the evidence that was reviewed and developed the guidelines for children, youth with disabilities, they're based on 3 reviews, at least what's stated in the document. 2 reviews on children and adolescents with intellectual disabilities, and 1 review with children and youth with attention deficit hyperactivity disorder. And we'll looking further at the strength of that evidence. It's indicated that there's limited evidence for the relationship between physical activity and physical functioning in children and adults with intellectual disabilities, and that there's moderate evidence for the relationship between moderate to vigorous physical activity on cognitive function, specifically for individuals with attention deficit hyperactivity disorder. So I think it's important to recognize how it is great to see the inclusive nature of these guidelines, but also to be really cautious in terms of the evidence or lack thereof, what they're based on right now, specifically to children and youth with other types of disabilities that don't include intellectual disability and attention deficit hyperactivity disorder. Now, the rest of my talk is going to focus more on the research that my team has positioned around the movement behaviors in the context of the Canadian 24-hour movement guidelines for children and youth. And I've noticed several people who've joined on the call recognizing names, but perhaps not everybody on the call is from Canada. So I just wanted to do a high-level overview of those guidelines. So they were first established in 2015 and released by Participation, which is a national non-profit organization that aims to promote physical activity among all Canadians. As the name would suggest, these are an integration of physical activity, sedentary behavior, and sleep guidelines for children and youth based on several systematic reviews that did not include children and youth with disabilities. So in terms of what those specific guidelines are, I'll walk through each of the categories. So first is the sweat category. And this, as it would suggest by this name, represents moderate to vigorous physical activity. And it's recommended that children and youth engage in at least 60 minutes of moderate to vigorous physical activity each day. So very similar to what we see in the World Health Organization guidelines. The sit category, as it would suggest, it focuses on sedentary behavior, specifically in recreational screen time. And it's recommended that children and youth engage in less than 2 hours a day in recreational screen time. And then there is the last guideline in relation to sleep. So depending on the age of the child or youth, the recommendations change slightly. So for children ages 5 to 13 years of age, it's recommended they have at least 9 to 11 hours of quality sleep. And then for those youth ages 14 to 17, it's recommended they get 8 to 10 hours of quality sleep. Now, given the focus of my talk today is thinking about whether or not disability fits into these particular guidelines, I want to first get you to think about in terms of the language that's used and whether or not it's inclusive. And this is by no means to put down the tremendous work that Participation has done around the promotion of these guidelines, but I think it's really important to put an inclusive lens when we look at these types of guidelines and promotions around them. So we take dissect a bit those categories. So first, in terms of the sweat, that moderate to vigorous physical activity, this suggests that sweating is there's a universal ability to sweat. And so, for example, we know that is not the case. For individuals with a spinal cord injury, specifically a high-level spinal cord injury, depending on the injury lies, they may not have the physiological ability to sweat. And that means if they're engaging in high-level intensities without sweating, they can risk going into overheating. Secondly, we look at that step, which doesn't have a specific guideline around it. It's just suggested that children and youth engage in as much light physical activities as they can throughout the day. But the term sweat in and of itself is not inclusive to other modes of mobility. So for example, a child who uses a wheelchair, for them, do they relate to that term step? Likely not. And then lastly, and probably for me most problematically, is the guideline around sit, specifically recreational screen time, but the negative connotation with sitting in this case. So how do we count for wheelchair users in terms of that reducing that sitting, that screen time, the recreational screen time? And for those children and youth who use a screen device as a primary mode of communication, how do we start to navigate around that less than 2 hours a day of recreational screen time? Now, I'm not the first to dissect this language. A really good colleague of mine, Dr. Amy Latimer-Chung at Queen's University, who's also part of the Canadian Disability Participation Project, she spearheaded a group which developed a resource for parents of children and youth with disabilities to help them navigate through the language around the guidelines and provide more inclusive examples of activities. And so this is called the Ability Toolkit, which is available for those who are interested on both the Canadian Society of Exercise Physiology website, as well as the Canadian Disability Participation Project website. And lastly, just again, trying to get you to think in terms of that inclusive lens, a little bit of a personal exercise I had done, something I've always been interested in, is looking at how representative our national report card that is released by Participation. So not necessarily it's globally done, but several countries have released this a national physical activity report card for children and youth. It's a great way to see from a national level how our children are doing or not in terms of their physical activity, their screen time, their sport participation, etc. So since 2005, this report card has been released first every year up until 2016, and now it's released biannually. And so what I had done is I'd gone through each of those report cards and then looked at the citations to see how many of those were specific to children and youth with disabilities relative to the larger references that were cited for each report card. And as you can see, and perhaps not surprising, given that we know that there's a lack of evidence on the movement behaviors of children and youth with disabilities, we see a low representation of citations specific to children and youth with disabilities. I think what's encouraging is we are seeing this general trend of a slight increase. And in 2018, there was a specific positional statement around brain health in children, where we saw a lot of citations from studies around autism, intellectual disability, and attention deficit hyperactivity disorder. So that's encouraging. And it's nothing to say that Participation with that report card is not trying to be inclusive. It's more saying we need more data to be added to that report card. So this next part of my talk, I'm going to be doing an application of the research that my team and I have been conducting, looking at a national physical activity measurement study to be able to apply the Canadian Physical Activity and Screen Time Guidelines to children and youth with disabilities. So the National Physical Activity Measurement Study, or our team likes to shorten it as the NPAM study, it has two phases to it. So this first phase, which was recently published in Disability and Health, was a small-scale study focused on youth with physical and sensory disabilities. And I'm going to showcase the findings from that study, but I first want to highlight that my tremendous colleagues involved in this research, many of whom are also part of the Canadian Disability Participation Project, but also some of you may be familiar with Tim Olds at the University of South Australia. So Tim collaborated with us on this project where we applied the multi-activity assessment or recall assessment for children and adolescents, or the MARCA, to look at the percentage of time that these youth were engaged in different types of physical activity, screen time, and sleep over the previous 24 hours. So the objective of this first phase of NPAM was to cross-sectionally examine the 24-hour movement behaviors and guideline adherence in youth with physical and sensory disabilities. And as I noted earlier, quite proudly that this paper is recently published in Disability and Health. So this study was a pilot study, a small-scale study. However, not to say that it didn't involve lots of effort to recruit the 54 youth who took part in this study. And I provided you there some graphics in terms of the demographics of our sample. But at a high level, you can see there that we have youth, 40% of our youth in the sample who used a manual wheelchair, 25% of them identified as having a visual impairment, and almost an equal balance of boys and girls. So again, the tool that we used was the MARCA, and this is a 24-hour recall, and we administered it over the phone over 2 different time points. And the MARCA, the way it works, you work from the moment the youth wakes up in the morning to when they go to sleep, in 5-minute segments, asking them what they've done through their day, and depending on the activity, the intensity of the activity, and how long. So I've shown you here a breakdown of the percent of time that the youth spent in each of those activity categories with sweat, sit, and sleep, and then other activities. And I would say very similar to what we see with youth without disability, we see a smaller percentage of time being spent in that sweat category, in this case, 6% of the time in our youth with physical and sensory disabilities, more time spent sitting, and then a good portion of the time spent sleeping. Now we take a deeper dive in terms of the physical activities that the time spent in physical activity at any intensity. The sample, we see here that about 85 minutes a day overall that the youth spent in physical activity. So I would say a pretty active sample that we had to work with here. And of those 85 minutes, 77 minutes were spent in moderate to vigorous physical activity. But something that I find to be quite interesting when we look at the types of activity that was accumulated with regards to this moderate to vigorous physical activity and other types of intensity of physical activity, it comes mainly from active transportation, so specifically wheeling and walking to school. So obviously we know there's tremendous benefits with that type of activity. However, interestingly, we see less of that representation of their physical activity accumulated through sports and play, which play may make sense given the age of this group, but the sports piece of it. And that may be suggesting, linking back to that limited access perhaps to programs or involvement in within the school. But again, that's a bit of a, we didn't collect that specific data, but I think that's just something that our group found quite interesting when we looked at these data. And then with the time spent in any screen time activity, again, over those 2 24-hour recall periods, I've shown you there the breakdown, the different types of screen behaviors, but maybe it's a surprise, maybe it's not, where we see double amount of time spent in screen time than what's recommended. So again, that recommendation of less than 2 hours a day spent in screen time. So our youth were engaging in screen time over 4 hours a day. And then when we align our sample in terms of the percent of them meeting those different guidelines. So we see just over 22% of our sample meeting that sweat guideline, less than 2% meeting the sit, and about 20% meeting the sleep. And then we look at what the integration of the 3 and what percent of our sample were meeting all 3 of those guidelines. That goes down to less than 4%, so 3.7%. So you may be asking, which often gets asked, is, well, how does this compare to children and youth without disabilities? Well, it's something that is not an easy comparison. I did anticipate this may be thought from some and brought in here the data from the 2020 participation report card. And so these are the percentages of the children and youth, Canadian children and youth meeting the sweat guidelines, the sit guidelines, the sleep guidelines, and then in brackets is the grade that's associated with it. So overall, we see compared to our sample of youth with physical and sensory disabilities, these numbers are higher. And then when we look at, in case what's reported in the report card, just under 20% of children and youth without disabilities are meeting guidelines. And again, our number was 3.7%. So some key take-home messages from this first phase of our NPAM study is that youth with physical and sensory disabilities fall short of Canada's 24-hour movement guidelines for children and youth, and that our evidence is limited by the small sample, as well as the narrow focus on youth versus children and physical and sensory disability. Now, recognizing these limitations, we were very fortunate to receive funding from the Canadian Tire Jumpstart Charities, which is the largest nonprofit organization that supports children in sport and physical activity. And so this is a 5-year project, which we're in year 2.5, where we're collecting data on movement behaviors of children and youth ages 4 to 17 with all types of disabilities. And a project of this size requires a large team, and I've noted all the great colleagues who are a part of this project, Sarah Moore being one of those. So what are our guiding research questions for NPAM 2.0? So we're interested in looking at, among school-age children and youth with disabilities, to what extent are they meeting the Canadian 24-hour movement guidelines? What types of physical activity are they engaging in? And what groups are in the greatest need for programs and services? And this number 3 really speaks to what I was speaking about earlier about having that reliable evidence base to then help inform decision-making around programs and policies. How does NPAM 2.0 capture movement behaviors? Well, if you recall, in our first phase, it was primarily through fully through the telephone-based interviews using the MARCA. Well, given the additional funding that we received, we've expanded it to include parents. So we have a parent survey. It takes about 30 minutes, administered through REDCaps, and parents are asked questions about their child's physical activity in and outside of school, their child's screen time, as well as sleep. We also ask questions around parent support behaviors and a survey around their child's mental health. We also have been fortunate through our funders to receive Fitbits to give out to the children and youth, and they are also able to keep that, which is a nice little bonus. And that allows us to capture 28 days of minute-by-minute heart rate and step count data. And I'm very thankful, I'm not sure if she's on the call, but I'm very thankful to have Christine Voss be part of our team. She's an expert in this, and I know that she's busily going through those data right now. And then lastly, we have that telephone interview as well as survey where we have children ages 10 to 17 who have the cognitive capacity to complete this survey, because we are wanting to get the voices of children heard in our study. So these are a three-pronged approach to collecting these movement behavior data. And I've shown to you there the current numbers we're at. And what the goal is to have 800 to 1,000 parent-reported data will make up this national survey or this national study. So this is perhaps one of the slides I'm most proud about is our study reach. It's no easy feat to do a national study, and by no means do we have a fully representative national sample. However, we have reached all provinces and territories with the exception of Nunavut at the top here, which we definitely, I think in the near future, will be able to recruit more children and youth there. We are working very hard during these interesting times to forge more collaborations with different types of community organizations to broaden our reach to children and youth, particularly those with physical disabilities and sensory disabilities. So in terms of the demographics, I've shown the demographics based on the parent survey responses of 495 parents, and you can see there the breakdown, the higher number of boys versus girls. I think that really is indicative of some of our recruitment strategies earlier on. So for example, Canucks Autism was a fabulous community partner, and we think about autism being a higher rates of boys versus girls. So that may be slightly why we're seeing that. And with disability type, we have a larger representation of developmental disabilities. So for example, autism, intellectual disabilities. But as I mentioned earlier, was that we are forging stronger community collaborations and clinic collaborations to increase the representation of those children and youth with other types of disabilities. So these next 3 or 4 slides, I'm going to present to you some preliminary data where it's based on items from the World Health Organization's Health and Behavior School Children Survey. And so these particular data that you're looking at speak to the question that parents are asked about the number of days their child is physically active, any intensity, for at least 60 minutes. So I've shown you the total sample, so again, 400, or in this case, 480 parents, children, so that's ages 5 to 11, and then youth, ages 12 to 17. Now, what we see there is when we look at the bars, we see the most common response of being 1 to 3 days. And again, this is at any intensity, not even that sweat category. Now, when we look at that sweat category, parents are asked the duration their child is engaged in activities that make them sweat or breathe hard. And here we see the most common response across either the total sample, children and youth, being 30 to less than 60 minutes of their child engaged in that sweat type physical activity. And with frequency, so looking at the number of days their child is engaged into sweat type physical activities, most common is about 2 to 3 days a week, where youth we even see a slightly lower 1 day per week. All to say is that we look back at those guidelines of sweat of at least 60 minutes, 7 days a week, our sample is definitely not meeting that guideline. And as I mentioned, other questions we ask parents looking in school versus out of school, and we know there's literature of supporting often negative experiences children and youth experience in school and physical activity, whether it be recess or in physical education class. So it's something that's of interest to us, the context in which they're active or not. And so on the left-hand side are numbers that are data that's related to these survey items on the National Longitudinal Survey in Children and Youth. That's the Statistics Canada uses this survey. And you can see there the percent in terms of children and youth, and this is parent report, your child is engaged in coach or instructor supported physical activity during school, as well as those more unstructured activities. So we do have a good percent of our children and youth, there was parents reporting their child's engaged in unstructured and organized activities at school, but we see a larger percentage outside of school. And this really, to me, shows the value that parents have in those community-based programs that are outside of school. Moving on to the SIT category, so that sedentary behavior, and specifically the recreational screen time. The item that we ask here, which I've gathered the data around, is parents are asked their daily time their child spent using screen devices. And we ask about different types of devices, and probably similar to all children and youth, that we see lots of variety in terms of the screen behaviors in our sample. And when we take a combined value of all those different screen behaviors and also weighted for weekend versus weekday, we see just over 80% of our sample engaging in 2 hours or more of screen time behavior, recreational screen time. And keep in mind, this is prior to COVID. So going back, similar to the other phase one, where we align our sample, in this case of children and youth ages 4 to 17 with all types of disabilities, their percent meeting the different movement behavior categories. So we have, for children, 2% of our sample are meeting the sweat, 0% of youth are meeting the sweat category, 20% of the sample of children meeting that sit recommendation, 2% of youth. And then in terms of children and youth with regards to their sleep, relative to sitting and sweating, they seem to be doing much better here. And when we align all three of those movement behaviors and percent of our sample of children and youth meeting all three, it is very low. We see just over 1% of children and 0% of youth, and none of those are girls. So as I mentioned, this is a 5-year cross-sectional study. So thus far, our results show that based on parent report, Canadian children and youth with disabilities fall severely short of the sweat and sit recommendations of the Canadian 24-hour movement guidelines for children and youth. Now, my hope is, I know that right now it's very uncertain with COVID, but we do hope to continue our data collection in the new year, whatever that new year looks like for each and every one of us. However, on the topic of COVID, our team, specifically Sarah, myself, Kathleen Martin-Guinness, and our research coordinator, Ritu Sharma, we did take advantage of the opportunity to look at the impact of the COVID-19 restrictions on movement behaviors in children and youth with disabilities within our smaller NPAM sample, I should say smaller, a sample of 495 parents who with that phase 2. So we reached out to those parents in May, and during May 2020, in Canada at least, we started to see some of the restrictions being lifted depending on what province or territory you lived in. That time period lagged. Of the 495 parents, we had 151 parents who responded to our survey. And what I'm going to show you today is just a glimpse of the data that we gathered, but it really does speak to us or speak to the impact that COVID's having on children and youth with disabilities. So we see in terms of their movement behaviors, declines in regards to their outdoor physical activity, less walking, wheeling, or biking, increased recreational screen time. Interestingly, sleep doesn't seem to be impacted as much. And then we look at that balance of the sleep, sitting, and sweating behaviors. There's a 50% of decline in that balance, in that healthy balance. And then something that I find most concerning is that we see among our sample of 151 children and youth with disabilities, almost 20% or a fifth of our sample, the parents are saying their child is experiencing a decline in their health, whether that be mental health or physical health. And thinking about this particular population, how they tend to have poor health outcomes to begin with, the severity of that finding, the long-term potential impacts. And I put a caution on the findings here because, being a parent, I have 2 young children, I see the impact on the movement behaviors of COVID on my children. I think it's really important to think about children and youth with disabilities who, again, they're often denied that right to the fundamental right to play, and maybe even are often further at risk of secondary health complications. These declines are very concerning. And I wanted to highlight here, this is an article, it was published in June 2020 by the National Center for Health, Physical Activity and Disability, and just recognizing that while we may open up our doors with regards to sport and physical activity, that there's likely going to be more hesitancy for families of children with disabilities to come back to sport. And this is something that I've heard when a lot of the different disability sport organizations that I work with. So kind of drawing to the conclusion of my talk, I think on a high note, we see that evidence on movement behaviors in children and youth with disabilities is accumulating. The study that I shared with you is one of, we're seeing several great studies coming out, and I've just noted a few here. There's many more, and I apologize if I missed if your study is part of that. But just to highlight, over the past 5 years, the increase in this, in the interest in this research area. And when we look at in terms of internationally, in the Netherlands, for example, and Tim Talkins in this group, they have a Dutch report card called the Dutch Report Card Plus that's specific to children and youth with disabilities. I mean, how cool is that? And I'm really hoping something that we could aspire to in Canada and help elsewhere. But I also would like to recognize that we are seeing more citations, more data coming in and represented in our report card, our national report card in Canada. While this evidence is accumulating, we also need more reliable evidence to address the activity gap. Sadly, we still see things around lack of access to sport for children with disabilities, this activity gap between those who are disabled versus non-disabled. And it's even recognized in the World Health Organization's guidelines that they released in 2020. The research gap is that there's a dearth of evidence from subpopulations, including persons living with disabilities. And my hope is that in the next 5 years, we will be running, building more evidence within what currently is available in that World Health Organization supporting evidence document to really help enhance guidelines as well as programs and policies to support children and youth with disabilities and physical activity. So revisiting those key messages, first is that access and inclusion to physical activity plays a critical role on the movement behaviors of children and youth with disabilities, that a reliable evidence base is necessary for effective decision-making on programs and policies impacting the health and well-being of children and youth with disabilities, and that multi-center community partner collaborations are fundamental to building a reliable evidence base on the movement behaviors of children and youth with disabilities. And I'd like to end off with acknowledging my wonderful collaborators, staff, as well as our incredible funders for whom this work could not be done. And as most importantly, all of the families who have chosen to participate in NPAM and the incredible support that we've received from our community partners. Thank you.
Great. Thank you so much, Kelly. That was a lovely talk. And I know that we have these conversations regularly. So really important work and meaningful work that you are doing, as well as the rest of the team. So just as a reminder, we will take questions for approximately the next 20 minutes. I do see that some of those questions are coming in through the chat, but if you don't mind using the Q&A, and I will filter those off to Kelly. But why don't we go ahead and get started with a question that I know I'm often asked, Kelly. And so you talk about the importance of access and inclusion, and that access and inclusion is vital to the development of healthy movement behaviors in children and youth with disabilities. I know sometimes we use those terms synonymously. So can you just define access, and how is it different than inclusion, and how can we promote access and inclusion for kids with disabilities?
That's a good question. You know, access, I think, it's I think making things, the awareness around it, and that so let's say in terms of the programs, what's out there, having the awareness for parents to know, and the access to those programs. Inclusion, so while you can know that a program's available and maybe have access to within like having funding, the inclusion piece of it for me is really, that's the commitment to really being welcoming to all abilities. So where you have programs that you have staff adequately trained to be able to adapt different activities accordingly. You're not having access to a program that you have to meet a certain criteria. That's, you have access to that program, but it's not inclusive. I hope that, yeah, I hope that.
Yeah, no, absolutely. Yeah, certainly one that's what's challenging to ensure that the definitions are available.
Sarah, can I just add, I think it's interesting
Certainly.
right now, we've had discussions, and we did a webinar earlier around, you know, virtual programs. So we could think, oh, that's greater access to programs, but, you know, we've all learned, and I think those of us maybe had children who've been doing online learning, access to those platforms is often a problem. So that's a really, I think, a really good example, looking at the difference between the two. Like, you could still have the bandwidth to be part of something, but it's not inclusive.
Thank you. Just as we have a few other questions coming in, so I think we can all agree that there are some notable challenges for the guidelines for children and youth with disabilities. And so in your estimation, what needs to be done to better establish guidelines for children and youth with disabilities? Or maybe I could even ask the question, do we even need guidelines that are specific for kids with disabilities, or is it too individual? Do we need to think about prescription in a different way?
Oh, that's a hard one. You know, I think there is a place for guidelines, and there are, you know, parents that we've heard from children with disabilities saying, I don't see my child represented in those guidelines. There's, you know, they don't include me, and that they want their child to be included, so they want to know. So from that standpoint, I think there's value in having those guidelines. But, you know, there is, I think it's a guideline. It's not a policy. It's not a requirement. It really takes the clinical expertise to then individualize that. I think where I find challenges, if you don't have those clinical expertise and you're a parent and you're with your child and you're wanting them to be active, and you're thinking, oh my goodness, my child's not getting that 60 minutes a day of moderate vigorous physical activity. What am I going to do? And our data really speak to, like, well, you're setting high standards potentially for that. And no, we need a lot more research around dose response relationships, or what's the minimum amount. I think that's where my concern really lies, is that the minimum amount, because if you go to beyond that, you risk physical injury and also deflation in people's, you know, self-esteem. So it's really hard. I think, you know, kudos to World Health Organization really wanting to be more inclusive, and they have included, you know, reviews in there, and they do mention about the guidelines with in specific to intellectual disability. But I think there are just a lot of concerns with that, and there should be like caveats around it. And these are something that, you know, work towards that progression really need to be stressed within those guidelines.
Yeah, thank you. A few questions coming in the Q&A now. So just a little bit more about how we best capture movement in kids with disabilities. And so Erin asked the question, are we seeing differences between the physical activity perhaps or other movement behaviors in parent report versus the Fitbit data? How do those things compare?
Oh, that's such a good question, and I don't have a response to that right now. You know, the Fitbit data, so as I mentioned, like this, and Sarah, you know Christine quite well, and Christine's been working with our team and providing the expertise around that. So we, you know, it was a huge learning for me of how to actually capture the Fitbit data, working with our IT department, because if you have, you know, we worked, I had to ask a quote for Fitabase, and I'm like, I cannot afford that amount. So how do you work? We had to work with in-house for our IT department. So that took a bit of learning. And so right now we haven't yet been able to look at the Fitbit data with regards to comparability, because right now we're trying to validate it first. Obviously the import is not valid. You know, it's hard then to look at that. I think there's going to be differences, but I also make the argument is that I truly believe that parents of children with disabilities know their child much better than me, being a parent of a child without a disability. And, you know, and it may not always be the case, but I think children who have a moderate to severe disability, parents are there all the time, often, or, you know, there may be their guardians in place and they have a good sense of who their child is and what they do. So it'll be very interesting, but at the same time, you know, we have parent report data. It's like, do you not get that? And then, but it'll be really interesting to see. So give me a year and a half, and I can answer that question.
Yeah. Thanks, Kelly. And I know that Casey had also said, how do you assure the accuracy of these activities when we're correlating them to things like step count? And so certainly some challenges in terms of capturing those measurements. And Christine Voss and Emily Bremer are both on the call. So thanks to the hard work that they're doing. Let's go to a couple of COVID questions. So I'm going to combine a couple of questions here in the chat and in the Q&A. So Janet says, I really appreciate your presentation. I applaud your reach to pivot during COVID and understand how the pandemic was affecting this population. And Erin is wondering if we saw differences between kids with sensory disabilities versus kids with physical disabilities in terms of their movement behaviors.
Yeah, good question. You know, I think our samples are quite small, and we haven't looked at the disability type. And Sarah, please jump in now and answer this question. But you know, I'm really cautious right now of the sample that we have to do that. We do have, it's a smaller group. I can't think of maybe like 10 or so kids with physical disabilities in that small sample, and even similar probably sensory. So I don't think it would really be able to be appropriate to compare. But you know, I think from a sensory disability standpoint, I find that's quite interesting right now with the pandemic, where we look at markings that are, for example, grocery stores. They don't know how the tactile surfacing. So not speaking to children with sensory disabilities, but more adults. I've spoken with a few adults with sensory disabilities, and just, you know, that the fear going out, being able to navigate this new world of this distancing, and really it's not friendly to those with sensory disabilities.
Yeah. And I think that when we were talking about the recovery period from COVID-19, it is going to be a challenge for kids with disabilities and their families to be able to navigate that. Risk is a whole different thing when we're talking about return to play during the transmission of a pretty significant virus. Yeah,
and if I could speak to that further, you know, I do a lot of work with Special Olympics Ontario, and the program manager there, he mentioned to me that, and this may be across Canada as well, but I know specifically Ontario, that, you know, they were ready to try to open more in-person programming in the fall, early fall, but the families, many of them did not want that. And I think they ended up doing about 10% of in-person and the rest virtual because of the hesitancy. So it's going to be really interesting. And I think at the end of the day, like, how can we support those families, and whether it be the data that we're collecting to further kind of change how policies are put in place, whatever it may be, but the support needs to be there, and the assurance. Your child comes in, this is what's going to happen in terms of what we have in place, and being able to walk the child through what to expect when they get there.
Yeah, excellent points. There's different touch points. If you're using a mobility aid, for example, there's different risks if you are bringing a support person. So certainly some challenges that will be unique to this population. I do know we have some folks that are working in parasport, and virtual programming is something that folks are doing right now. So congratulations to the folks that are on the call who've been creative in creating solutions for this population. Yeah. Let's move on to another question. So Sean says, and I'm gonna try to read it out here. How do you envision the work influencing program intervention development? So for example, should we be considering developing interventions for targeting multiple movement behaviors or targeting upstream priority movement behaviors to influence the other movement behaviors?
Oh, such a good question. I'm a simple kind of gal. Like, I really like to focus on one behavior. I think it's a lot to take in, but it's not to say that the one will impact the other. I feel like physical activity may be that one. I mean, I'm not a sleep expert, so it may depend on who you speak with their expertise, but I do think that the physical activity piece, from a social well-being standpoint, you think of screen time. I mean, screen time can be fun. Absolutely, like these virtual games can be lots of fun. So I'm not to say that, but I really do think that if moving forward, I would suggest focusing on one, and whether that one be the physical activity, given all the the benefits, the social, the physical, the psychological. That's kind of where I would put my eggs in that one basket if I had to.
Yeah, thanks, Kelly. Yeah, and certainly recognizing how they're playing off of each other. So kids with disabilities often have increased levels of sleep disturbances, for example, which can impact the other behaviors. And so perhaps if we're targeting physical activity, then that may assist with some of the other movement behaviors throughout the 24-hour period.
Yeah, and I think that, sorry, I'm just jumping in. Like, I think the sleep piece is interesting because I did think it would be impacted more than what parents are reporting. So maybe, I mean, again, it's a relatively smaller sample. So maybe they're good sleepers, but we do know, like, those children with disabilities tend to have like not as high quality sleep as typically developing children. So yeah, like physical activity can definitely lend benefits, I think, to sleep quality. And then if you're more active, you're less time on the screen, right?
Yeah, absolutely. Casey asked the question, and I'm not sure if we have these data or if you have these data, but are wondering if we've looked at, or you've looked at socioeconomic status with respect to meeting the guidelines in the disability population.
So we do have those data, but I have not yet looked at them, but definitely really important of, the intersectionality piece. So I appreciate the question, but it's something that when we dive a lot deeper with our data to be able to look at those types of demographics.
Mm-hmm. So as you know, there's a difference in terms of life expectancy for many adults with disabilities, and that's true for Canada, the US, as well as other spaces. So just curious, for those folks that would say, well, it's because of the disability, it's because of specific functional limitations due to the disability, it's due to health parameters that are related to the disability, it's not related to these lifestyle factors. What data do we have to support lifelong physical activity for persons with disability as a way to promote longevity and health for life?
In terms of with NPAM, or you're thinking with regards
generally
to...
Yeah, if you have other data that you know about that we can refer to. Is it, are individuals with disabilities living less long because of the disability, or is it because of some of these lifestyle factors that perhaps we can intervene with earlier on in the lifespan?
That's a great question. I can't think off the top of my head what data we have, but I mean, I would agree with that, but again, it has to have the supporting evidence. So I'm not sure. And I would love if someone's on the chat there to definitely chime in on that, because that is a really important question.
Yeah, thank you. Yeah, so I guess one of the other questions is in terms of like the long-term consequences of inactivity. We know that for the typically developing population, and just wondering if you have any thoughts on what are some of the consequences of inactivity specifically for kids with disabilities?
Right. I mean, you could think the physical, I mean, obviously physical deconditioning, that's, I would think first oftentimes comes to mind. But I think in terms of the social well-being, and we see data out there with regards to social isolation, less friends. So, I think physical activity can provide the opportunities for social relationships. And so, like being inactive, if you're not engaged in other leisure activities, so I'm not going to say those aren't important as well, I think, but the risk of those social connections, those peer relationships, I think those are things that we may not first think about when we think of the risk of inactivity. Mental health, the importance of physical activity. There's lots of research around its immediate effects on affect, levels of anxiety and depression. So that is absolutely the case, I would think, for children and youth with disabilities, as well as those without disabilities. And we know that there's higher risks in terms of depression and anxiety among those children with disabilities. So if physical activity, it's a first-line treatment for mild to moderate depression. So, I think that having that benefit, and for many of the children and youth with disabilities who are at greater risk of that, they would reap even further benefits than those who are not at risk of mild to moderate depression.
Yeah, thanks. You talked a little bit about the social importance of activity for these kids. Can you tell us a little bit about parental support and parental co-play, other things that parents can do to get their kids with disabilities moving? What do we know about that relationship?
Well, we know, I think, with the typically developed an active parent usually is active children, like family involvement. And we see within our COVID data that families are doing more together, that parents are engaging in physical activities with their child, whether it be indoors or outdoors. Something that was not presented there that we've seen through our data, Sarah, is, the indoor activity. So we see higher levels of more leisure activities, but not in terms of physical activities indoors. And that may speak even in terms of accessibility or lack thereof in people's homes. It becomes a bit more challenging. For example, if your child uses a wheelchair, you're indoors, if your house is not fully equipped to allow your child to wheel safely throughout. But yeah, parent support, regardless if your child has a disability or not, is critical. There's theories that have shown that conceptually the importance of that on children's motivation and their physical activity. And I think the research that my colleague, Rebecca Bassett-Gunter, that's been doing in this area, how do we support parents to support their children? What types of self-regulatory skills can we equip them with? For example, how do we help them with planning how they support their children? So that may not result in the child being physically active. It may help in terms of motivating the child. But although Deborah Brown, who I know is on the call, we did see links with parent support and that linking with a great increased child physical activity in our NPAM data.
Mm-hmm. One last question, and then we'll probably be ready to sign off here. Kelly,
Okay.
Thank you so much for today. So we do have a bunch of folks that are on the call that are coming from the pediatric exercise sciences, as you would expect from this group. So you talked about needing more evidence to be able to inform guidelines. So what recommendations would you make to pediatric exercise scientists that what do we need to do in order to better inform these guidelines and support kids with disabilities to get moving?
Yeah, I think I spoke to it earlier. I think we really need to know what's that minimum, because again, this is, people may arguably it's a small sample, 495 parents, or parent report data. I would say, hey, it's a pretty decent sample that we're working with here. Obviously there are some kids who are getting 7 days, but for the most part, the majority of our children and youth are not. So what is the minimum? Because my concern is that we're going to set the child up for failure. We're going to, reduce their confidence, and then all of a sudden they're no longer active. They're engaged in anything. So I would love to see research that really looks at like that dose response relationship. Does it need to be moderate to vigorous physical activity? Can it be mild? That light activity? Does it have to be vigorous? So it'd be really great to do more of these controlled studies around that piece, to be able to get a better sense of what are guidelines that we put in place that are realistic for children with disabilities to execute.
Thank you. There was one last question that came in from on the Q&A, so I'll just ask if anyone has any additional questions for them to just email Kelly directly at the email there, so kelly.arbour@utoronto.ca if you have any further questions. But I just really want to thank you, Dr. Arbour-Nicitopoulosto, for joining us today and for sharing a little bit about your research program with kids with disabilities. Really important and meaningful work. We do plan to continue these seminar series as Ali had mentioned. So the next one is in January, featuring Dr. Karen Pfeiffer. And please look out on our Facebook and Twitter accounts, so NASPEM, NASPEM. And if you'd like to hear more, then you can also email me. So it's Sarah, sarah.moore, MOORE, @dal.ca. So on behalf of NASPEM and the Board of Directors, thank you again for joining us today. Thank you again, Kelly, for your talk. Now let's all stand up and get moving a little bit here and continue to support kids with disabilities and all kids to be active. Goodbye for now, and happy holidays, everyone. Thank you.